physical assessment part 2. First, I'm going to check her apical pulse. Okay, her apical pulse is 76. So now I'm going to check her brachial pulse. Her apical was regular. I mean, it was, within range, and the rhythm was regular. Okay, the brachial was also 76. I'm going to check it bilaterally. Okay, and that's also 76. So now I'm going to check her ulnar. Okay, that one's also 76. I'll check it bilaterally. Well, okay, and also 76. So she has no presence of edema, and I'll check her temperature bilaterally, and her skin feels the same on both sides. I'm going to count her respiratory rates. Okay, her respiratory rate was 16. It's regular and unlabored. She doesn't have any shortness of breath. Do you have a cough?
No.
Okay, so she has no cough, so no sputum or anything. Now I'm going to check her chest expansion. Okay, I'll turn around. Okay, and it expands symmetrically on both sides. So now I'll check her lung sounds. Okay, now turn around for me. Okay, her lungs are clear to osculation bilaterally. Now I'm going to check your nasal patency. So hold one side and breathe in and out. Okay, now do the other side. Okay, and her nose is patent. Alright, so now I'm going to check your vowel sounds. So if you lay down, you can leave your shoes on. Okay. Her contour is flat. Start. Okay, and her bowel sounds are normal, active in all 4 quadrants. Have you had any nausea or vomiting?
No.
Okay. What about your last bowel movement?
Yesterday.
Yesterday.
Mm-hmm.
What was the color?
Brown.
Brown. What about the consistency?
Formed.
It was formed.
Mm-hmm.
Okay. Did you have any presence of blood?
Mm-mm.
Anything like that? Do you have any colonoscopies
No.
or anything? Alright. What about your last time you urinated?
About 20 minutes ago.
20 minutes ago. Okay. What about, what color was it?
Light yellow.
Light yellow?
Mm-hmm.
Do you have any pain, urination? Was there any foul odors or
No.
anything? Any clots?
Mm-mm.
Let's see. Do you get up in the middle of the night to use the bathroom a lot?
Not a whole lot.
No. Do you have any dribbling or anything like that? Do you have any urinostomies?
No.
How many times a day do you?
5 or 6.
5 or 6.
Mm-hmm.
That's normal. The normal range is from 1,200 to 1,500 milliliters a day. But if you're not having any more than 30 milliliters an hour, then you should see your doctor.
Okay.
Okay, now we're gonna do the self breast exam. But first, your anus should be darkly pigmented, and it should be tightly closed. And that would mean your anus is patent.
Okay.
So to do the self breast exam, you want to there's 3 different ways you can do it. You can start from the side and go up and down, palpating, but you never take your fingers off the breast. You want to feel for any masses or any swelling or edema or any tenderness, any like you want to make sure they're both symmetrical. A little bit off is okay, but they should generally be about the same size. So you can either go up and down like this. You can start from the nipple and go in a circular motion out all the way around to the edge. Still not picking your fingers all the way up off the whole time. Or you can start from the nipple and go out in a wedge motion. Just go from the center all the way out to the side. You want to do that once a month, either around your menstrual cycle, or you can do it like at a certain time of the month when you pay a certain bill or something. And the same goes for your significant other. Have them check their testicles once a month. You know, around the same time every month. And they want to use 2 fingers and their thumb just to palpate all the way around, feeling for any masses or swelling or any tenderness or anything like that. And then they'll also want to feel of the epididymis for any masses or swelling or tenderness, and that's the cord-like structure underneath the scrotum.
Okay.